Welcome, everyone, and thank you for joining. I really appreciate your time, and I have a few opening remarks I would love to share with you before I pass it over to Jim Saylor and to Pacifique. But I think the reason why we're all joined here today is in solidarity for what I like to call, and my great mentor and dear friend Paul Farmer called, making the invisible visible. And what I mean by that is giving voice and presence to patients in developing countries, to people in developing countries and their families who may not otherwise have a chance to share their voice in forums and to express their needs, whether their healthcare needs or otherwise. And I think we're here in solidarity for that cause, speaking very broadly. And I also think that there's a tapestry of global health equity that we all believe in. And that tapestry is not just made up of physicians, and it's not just nurses, and it's not just pharmacists, and it's not only patients, but it is the team, the collaborative care team, and the social determinants and the social forces that really push back at patients finding their best health and their best life. And those forces have, gravitational push against the patient well-being. But I really believe that organizations like Venue can push back at those forces and change them and mold them through great determination, and with, camaraderie and collaboration from people like you who are here today, and from those who will be joining us with the recording later. So as you know, the purpose of Venue is really ambitious. It is to change the course of human health and to transform the landscape of patient care. I will let Jim and Pacifique speak about this goal really from their perspectives, because all of you have heard a lot about Venue from me, and I really want to give their voice an opportunity to shine here. I'll just say that, that solution that we're designing and we're implementing, it's working. It's not just an idea. It's not just a trial or an experiment. We're really seeing incredible results in the developing countries around the world where we're working. And our interventions are basically three-pronged, just as a reminder to all of us. One is the design of our educational training. The second one is the delivery of that training and education, whether it's in the classroom, bringing our solution to the doorstep of healthcare workers in developing countries to make sure that it's easily accessible to those pharmacy workers and healthcare workers who are so busy being dedicated to their patients, working around their shifts, and breaking down barriers to education. And that's the delivery science. And then the third prong of our solution is transformation science, which is essentially enabling our solution to really fly with the digital tools and the platform that we have built for the digital training for pharmacy workers. It's the first of its kind. It's never been done before. An educational platform, a collaborative space to give voice to pharmacy workers in a way that they've never had it before, both separate and apart and distinct from other healthcare workers, to recognize them and illuminate their important role. And then also as part of the collaborative care team. So combined, these three prongs make up Venue's solution to really moving the needle on patient care and health outcomes. And I will now pass the baton to Jim Saylor, who I think almost all of you know. I won't say too much about Jim's background because that might take up most of our day. He is so accomplished and revered, and we're very grateful to have him as a Venue board member, collaborator and mentor and inspiring colleague to all of us. And as many of you know, he also, of course, wears his full-time hat as the executive director at the Population Council Center for Biomedical Research, but he's here today in his capacity as a Venue champion. So I will let you take it away. Go ahead, Jim.
Thank you so much, Tammy. It's a real pleasure to be here. And I'll just add one or two things to what you said. I mean, the thing that's so exciting about what Venue is doing is it's targeting kind of an underserved area in healthcare delivery. Number one. And the other thing that is really in keeping with where the global development community is going right now is it's investing not just in outcomes for patients, but it's investing in people and building and sharing capacity of people to deliver and to learn and to know. And that is just absolutely the cutting edge, right thing to be doing at this moment. And it's why I'm very lucky to be associated with Venue in any way. But what we're really here to hear from is Pacifique today. And so what we're going to do is a short, I have some questions for you, Pacifique, and then we're going to open it for anyone else who wants to ask questions. And I could recite your background, but I think it would be much better if you could tell us, your story is so compelling, if you could tell us about your story and how you came to be at Venue.
Thank you, Jim. It's a great pleasure to be here today, and I'm really happy to share my story and from my childhood and how I joined Venue. So thank you so much for this platform. I'm the firstborn of in a middle-class family of 2 children. We lived a happy life with my family during my first years of existence until the time things suddenly changed. I was 9 years old and about to enter 3rd grade when the genocide against Tutsis in Rwanda began in 1994, forcing my family and I to flee home. My family and I had to rebuild our lives in 3 different refugee camps in Tanzania. After 3 years in refugee camps, we returned to our beautiful country, Rwanda, but we had to get used to a new life without our beloved father, who was assassinated. It was not the home we remembered. Our mother had to raise 2 children alone in very challenging situations. Nevertheless, my younger brother and I, we knew that we had to get an education. Our mom kept motivating us, saying that if you go to school, if you remain focused, you will become important people, you will be able to serve the community. So after seeing how sick, poor people were dying in crowded, dirty camps, I decided medicine or pharmacy was my calling. In fact, we could have died anytime because of weak health systems, lack of medicines and medical supplies, lack of skilled healthcare providers, and the lack of food. My brother remembered the extreme hunger we faced and set his sights on agriculture. Then we said, okay, let's divide and reign. So he followed agriculture, and then for me, I decided to do pharmacy. So my mother nurtured my love for education, hard work, humility, and service to others. I did not have shoes, and I could not afford more than a meal or 2 a day. Despite those adversities, I was always among the best performing students in class, humble and happy to serve others. In grade 6, when I was 15 years old, I was the best performing student in Kibungo, my home province. By the end of the 6-year primary school, I was among the top 10 students in my country. And then our reward was a government-sponsored trip to Switzerland, where I interacted with other children from war-affected countries, as well as other stable and developed countries in Europe. This trip was a life-changing and eye-opening experience. It restored my hope for a bright future, and I got to understand that with hard work, living a life of purpose, humility, collaboration, and service to others, I could reach my full potential despite the bitter past. Years later, I decided pharmacy would be my profession. I wanted people-oriented profession that provides a reward in knowing that I have helped someone who is in need. In fact, I have benefited from the support, humanitarian support from the international community, and I felt that I have that responsibility to give back. Knowing that pharmacy is a vital part of the healthcare system with an ultimate goal of ensuring availability, safe and effective use of medicines for achieving definite outcomes that improve patient quality of life, my passion drove me to study pharmacy at the University of Rwanda and prepared me for such a lifelong commitment. Over the past few years, we know that the role of pharmacists have been evolving to meet the needs of modern healthcare systems and the needs of our populations. I was also inspired by the concept by the World Health Organization, the concept of 8-star pharmacists to cover the roles of modern pharmacists, such as a caregiver, a decision maker, communicator, manager, lifelong learner, teacher, leader, and researcher. Those roles align with my values and reflect my future career goals. I believe that health is a human right. As a pharmacist, manager, leader, supply chain professional, and researcher, I have the moral responsibility to contribute to and advocate for global health equity by fighting social injustice, but also promoting pharmacy workforce development, which is in some settings, it's almost forgotten. My goal is just to join my efforts with other global health practitioners for a better world with robust, resilient, and sustainable health systems, promoting access to healthcare services for all without any discrimination, but also building a strong pharmacy workforce, especially in low-income countries. Further opportunities came my way when I won a one-year fellowship with Global Health Corps, which places young professionals with global health nonprofit organizations. Through this fellowship, I joined Partners in Health in Rwanda, and I was serving as a Global Health Corps fellow, but also serving as a pharmacy supply chain analyst. At the end of the fellowship, I was hired as the pharmacy program manager at Partners in Health in Rwanda, where I developed and managed the pharmacy program in 4 years. I collaborated with the team to create a robust system for monitoring and replenishing health commodities, and mentored young pharmacists from the University of Rwanda to follow in my footsteps. I have contributed to Partners in Health mission of providing a preferential option for the poor in healthcare by ensuring availability and proper use of medicines for rural and vulnerable communities in Rwanda. Working with Partners in Health has attracted my attention to global health delivery through learning from and collaborating with pioneers and other professionals in global health equity. Later on, I transitioned to West Africa to develop the pharmacy program and help strengthen healthcare systems devastated by Ebola outbreak, that is in Liberia. And I'm still serving as the pharmacy department lead at Partners in Health in Liberia, where we contribute to capacity building. We are building the capacity of the pharmacy workforce in Liberia, but also serving our patients to make sure, to ensure safe and effective use of essential health commodities. My work experience in Liberia has allowed me to interact with and share experiences and learn from global health practitioners from diverse backgrounds, witness more challenges in global health delivery, and expand my career aspirations. Further opportunities came my way when I was admitted to Harvard University to pursue my grad school in a Master of Medical Science in Global Health Delivery. And I was lucky to interact with different people with diverse backgrounds. And then that's how I came across Tammy, and I learned about Venue Foundation. I was very excited because it was my first time to learn about an organization that is really focusing on pharmacy workforce development. I knew about other associations of pharmacists or pharmaceutical societies advocating for pharmacy workforce development, etc. But Venue is unique. That's how I was really excited, and I said, this is the best organization to work with. Thank you.
Great, thank you, Pacifique. That what a story. I mean, and you know, you're really part of the elite. I mean, PHI and Global Health Corps and Harvard and so on and so forth. Maybe you could say just a few more words about why you decided that Venue was where you wanted to work, given that you really could have done anything.
Thank you so much. Thank you. In fact, like for the past 11 years, I've been working with Partners in Health, a very well-known international organization, both in Rwanda, in Liberia. I also worked briefly in Madagascar. And our work is just focusing on building health systems, pharmaceutical systems, and then ensuring sustainability, like to make sure that there's like the government has ownership to have strong systems, like ensure effective and safe use of health commodities. In addition to that, we realize there are gaps in pharmacy workforce development, where qualified pharmacists to serve in those settings, especially rural settings. And then not only that, but also other members of the pharmacy workforce, such as pharmacy technicians or dispensers, people who are dispensing pharmaceuticals. You realize there are gaps in this. Them, they lack really knowledge and basic skills to ensure safe and effective use of medications. And then that's how I started early in my careers with Partners in Health. That's how I started like a training young pharmacists. We were collaborating with the University of Rwanda to mentor young pharmacists so that they can follow in our footsteps, but also asking them also to train the next generation. So that's how like I can really describe my interest in pharmacy workforce development. Then when I learned about Venue as an organization that is really promoting pharmacy workforce development, that is really striving towards strong pharmacy workforce development in different parts of the world, I said, this is a perfect organization to work with because it's in line with my values. The work I do, like I'm mentoring the members of the pharmacy teams, but also I think I realized this was really a very good platform to work together to really advance pharmacy workforce development. And Venue is unique because I've never seen a similar organization in the same perspective, focusing on pharmacy workforce development, especially in low-income countries. And then I have heard about other programs such as Human Resources for Health. And I realized those programs, I remember they are also working in Rwanda. They focus on physicians, nurses, but they are not just focusing on pharmacists. And it's very important. And pharmacists are really key members of the health system. And in our settings here in low-income countries, we realize most of them are working in community or retail pharmacies where they really interact with the majority of the population. So they need to have like knowledge and skills, advanced knowledge and skills to really transmit the knowledge and skills to patients, but also ensuring that patients are really adhering to treatment. And then I realized Venue is the right organization to work with. And I'm really excited, and I look forward to working with Venue for the rest of my life. That's what I could say.
Thank you, Pacifique. And for those who have joined during the call, I'll just say that Pacifique works for Venue and has been telling us a little bit about how he came to Venue. I do have a follow-up question, but all of you will get a chance to ask a question in just a few minutes when we open this up, and Tammy will manage that. So Pacifique, you talked about the importance of the pharmacist in the community, which is, in low-income countries is maybe where there's some resource constraints, and the healthcare system very, very, very important. I'm wondering if you could tell us about, give us a little bit more of a flavor of that. Tell us about some patients you've interacted with, and why the pharmacist is so critical to some of these patients and clients.
Thank you, Jim. Thank you, Jim. I have been interacting with patients for the past 11 years, so I have many stories I could share. So let me choose just like some of them. Like you talk to patients, you realize like in most of low-income countries, you realize that the whole hospital has one pharmacist, one single pharmacist. Let's say, for instance, 100 beds hospital has only one pharmacist, and that pharmacist will not be able to manage the whole pharmaceutical system in the hospital. Mainly, you will realize to be focusing on one component, which is pharmaceutical supply chain management. So they have to first ensure pharmaceuticals are available, but also they have to make sure they are stored in very good conditions. They have to make sure that they are accessible to prescribers, but you realize they don't have other members of the pharmacy team to perform like clinical pharmacy roles, such as working with doctors to decide on treatment options, to check on drug-drug interactions, or just monitor the patient closely, because it's one pharmacist who is very busy ensuring that pharmaceuticals are available, ensuring that they are managed very well. And then you realize in those, most of, you realize either nurses are just serving as pharmacy technicians, even if they are not trained for that, or even people who don't have like a formal education from higher institutions like universities, like people who are just like a graduate from high school, just receiving like a short course or like a short formal training, and then they are the ones who are dispensing pharmaceuticals. And then you realize patients do not really know anything about the medication they are taking. So I remember one patient who were interacting came to me and said, doctor, so they think everyone who is working in the hospital is a doctor. So a patient came to me and then said, doctor, so tell me, what's the name of this medication? How does it work? Should I take the medication with food, or should I drink milk? Will I drink alcohol or not? Should I stop? So those are the questions the patient was asking me. And then you realize there are gaps, like people who are dispensing medications. And then I've been observing, be telling the patient, okay, take this tablet in the morning, noon, in the evening. That's all. You see, those are the gaps within the system. The patient is supposed to know the name of the medication. He's supposed to know how it works, briefly in simple terms that the patient will remember. The patient is supposed to know about drug interactions. You should avoid these particular medications. Or they should also know that, okay, this particular medication, you need to take it before meals or after meals, like those basic information. So that's what we have been doing. We have been working on training those staff on pharmaceutical counseling, medication dispensing, best practices, medication dispensing and counseling, so that the patient has the basics, because that we have the impact on patient outcomes, because on clinical outcomes. Because if the patient knows how the medication works, if the patient knows, oh, this medication is treating this particular condition, if the patient knows, okay, you should complete full treatment course, the patient will be careful, and the patient will be completing full like a treatment course, but also the patient will be adhering to treatment and clinical outcomes will be improved. That's one of the examples. Another one is about the antibiotics, like the use of antibiotics. Antibiotics are one group of medications which is very important, especially in treatment of bacterial infections. And then you talk to patients, like the patients come to you, they say, oh, doctor, I took the dose I got from the hospital for 2 days, and then I was feeling better, then I stopped. Then I shared with my brother who was not feeling well. So we continue, like we realize that the patient is supposed to be educated about the importance of like effective use of medications. And we just like work together to really make sure that the pharmacy workforce is really well equipped. They have the basic skills they know to tell the patients. And we introduce them to those concepts of antimicrobial resistance. If the patient is not taking full treatment course, that's a risk factor for developing antimicrobial resistance. If the patient is just like going to a drugstore and just asking, I need this particular antibiotic, and they just have viral infections, that will not solve the problem, but it will just contribute to antimicrobial resistance. So those are the issues we have been facing. Patients need to be educated, and they are enthusiastic about it. Or they tell you about like they are enthusiastic about the use of medications, but sometimes healthcare providers, they don't have full like skills and knowledge to share with the patients. That's why we say like, oh, Venue, this is a very important area where we should focus to make sure that the providers, pharmacy workforce, the team is really well trained. They have those skills, and then they will be able to educate the patients who will use medications appropriately, and then we'll be able to improve clinical outcomes. Thank you.
Thank you, Pacifique. I just have one more question for you. So, I mean, really great to be able to talk to somebody who deals directly with patients and understand the issues. And of course, what Venue's trying to do is with this platform, be able to affect so many different pharmacists and help so many different pharmacists, which pharmacists then have a multiplier effect to reach so many different patients. And the platform is one way of doing it. The other way, of course, is through partnerships. And wondering if you could just say a few words about some of the partnerships, and I think you have one with the University of Rwanda as another way of just multiplying the impact that you're trying to have.
Yes, thank you, Jim. Yeah, this work, we realize, like for it to be successful, we need to identify key stakeholders, people who are involved in pharmacy workforce development. For the case of Rwanda, we have so far identified the University of Rwanda as, like, especially the School of Pharmacy, which is really the only institution that is training all pharmacists in the country. So that's a very strategic partner. And of course, we also approached the National Pharmacy Council, which is like the pharmaceutical society, and they are just a regulatory body, but they oversee pharmacy practice in the country. So they are key partners, and also partners in health as a very important NGO working in pharmacy workforce development. Not only that, health systems strengthening. So they are also our partners that we really want to work with to advance pharmacy workforce development in Rwanda. And we did not forget about the Rwanda Pharmaceutical Student Association. We also want to listen to them. What are their needs? What are the gaps in the system? How can we work together to address them? So partnership is very key, and we want to address those issues in line with the local context. We want to know what are the main pharmaceutical needs in Rwanda after just discussing those partners, and how can we collaborate? Like what will be our contribution, and then what will be their contribution? So far we have had like preliminary meetings, and they are very excited. They're excited because they say we haven't had a similar partnership before, and like we have been involved in pharmacy workforce development alone. So we are happy to partner with other people. And most importantly, they are interested in, they like the fact that we have different ways, like different methodologies, like teaching methodologies, either in-person trainings or just like online through Zoom and other platforms, but also the digital hub. And they like the fact that it's free of charge, because they have been telling me that other organizations who provide like some continuous professional development courses, they charge pharmacists, and some of them they may not be able to afford like those courses, so and it's a requirement. That's required to have some credits every year before their licenses are renewed. So they are excited about this, and we know that like we reach out to other many pharmacists, and not only in Rwanda but also other countries in Africa, because the challenges are almost the same. So it's really very important, and we want to really strengthen those partnerships because if we collaborate, and we will be able to make impact together. Thank you.
So that's great. Thank you so much for summing that up, Pacifique. And so now what I'm going to do is turn it over to the person who came up with this very, very bold and audacious idea to offer a world-class training and education to tens of thousands of pharmacists around the world and not charge a penny for it. Is the vision behind Venue is the founder, Tammy. Over to you, Tammy.
Thank you both so very much. I really appreciate you tag teaming today, and it's a pleasure to give you both the stage for this type of fireside chat. And thank you everyone in our audience as well. So I would love to open it up to any questions you might have for Pacifique or Jim or myself, just to have a dialogue before we give some closing remarks. So I'll open the floor to you if you have any questions. Go ahead, John Townsend. You can, if
Jim knows I'm always quick on the questions.
Yes, we love that.
that was a great presentation. But there are a couple of things I'm trying to understand exactly how this works. So you could take this same presentation and say, look, we're working to mobilize the private sector in partnership with the public sector to make things go on. You could say, look, we're going to figure out what are the minimum skills required by community health workers. What should they know about how to interact with a pharmacist? There are lots of ways of shaping this, and I think if you're thinking about scaling up beyond what you're doing now and potentially have greater impact and larger numbers of partnerships, it'd be really helpful to kind of figure out which framework do you want to work with, where are there possibilities, and how do you go about mobilizing those partnerships. Two come to mind very quickly. Merck for Mothers, which works from a private sector standpoint and works with pharmacists in lots of countries, and has a great database, and also they understand pharmacy workers. They work largely with mothers and infants, but once the principles are there, I think you've articulated really well that those things work well. The second is Rotary International, which is also supporting private sector in lots of places in partnership with the government through drugs, through vaccines, through all kinds of things, and they're focusing on Africa. And I'm wondering, depending on what your outcomes, what the story is in terms of what the benefit is, how do you document that, and then what's the model that you want to push? Boy, there's many roads to take on this. I think you guys have a great basic idea, and figuring out how to explain that in a way that thinks about scale in both public and private sector. So there's plenty of time for conversation later on after this meeting, but I thought that would be one way of kicking it off to help us understand better the model.
Thank you. That's a fantastic question. I'll answer that if that's all right. Or just at least, continue the conversation. I don't think there's one singular answer, but it's a very, very deep, complex question. So what I would say is that, the big challenge here is that the vision is solid, right? And then how do we implement? How do we achieve that vision? How much time do we give ourselves? How do we resource it? Where do we start? So I would say that we essentially start where there's a confluence of need for what we do, and then the right opportunity at a good time. And so, that's why we have started in Bangladesh and been able to scale and grow our programs there, and then moved on to Nepal and Cambodia, where we're now accredited and, registered entities. And those things take time, right? And then learning from that and replicating it, 5 years later in a place like Rwanda, where I think our starting point is even stronger, in terms of we have dedicated funding to start in Rwanda. We've never had that before in South Asia, for example, or hiring someone like Pacifique, who is not only a pharmacist from University of Rwanda, but also came to the US, got his Master of Global Health Service Delivery from Harvard, and then is returned with the dedication and loyalty to his own home country. So a lot of it's about the people we hire, whether we're talking about Pacifique, or I'll give a nod to one of my partners in crime, Mohammed Abu Sayed, who has been with Venue, from the very beginning, at the seed of the idea initiation in Bangladesh together, and has stayed with us. So, and some our board members here, I have to nod to all of you also for staying the course, seeing the vision, and then also implementing it in a very incremental approach that we have to, trial and error, what works, what doesn't work. And I'll just give an example of, what are we doing here? What's our implementation strategy? And so one example is we started off with hospitals, and because it was easier to work with them, right? Than it was to you can have one person in a city and start working with a hospital pharmacy. You don't need an army of pharmacy workers across the nation, whatever country it is. And then that kind of led to other hospital-based partnerships. We found it easier initially as a startup to work in the private sector, rather than the public sector. That probably doesn't need much explaining right now. And then more recently, we really landed upon this brilliant kind of recognition that we're a global health entity, but we're doing education, and we're actually an education organization. So our additional model is, in addition to working with community pharmacies and hospital pharmacies, is working with universities. And I give credence to my in-country staff from the ground up, working on partnership development with universities. And now in Bangladesh and Cambodia, we have 5-year MOUs with 2 of the leading universities. And that's what we envision for Rwanda as well, where we're on campus. You know, we're our own entity, and we're like this, you know, pre-graduation requirement. You can't get your Bachelor of Pharmacy without going through the venue certification program. And it's great because we get a flow of students, right? So instead of a stock of pharmacy workers at a hospital or a retail pharmacy, we get this flow of students in the capital who then go out to communities across the whole country, and we embed the better practice change in the communities where we reach. So that's where we are now. I think we've also had questions about, are we going to be like the next Khan Academy of digital training, or are we going to need to continue classroom-based in-person training? And we were fortunate to go through the digital wave of using technology for education during COVID and seize upon that and learn that I really think there's still a human element. And we will have a digital platform that is proprietary, scalable, and useful, but it will certainly be complemented by and stewarded into different communities with the human touch. Our bilingual instructors who can also mentor and really, you know, I would say, Saeed and Pacifique, your first order of business is raising awareness of not only the role of the pharmacy worker, but their role in lifelong learning to keep up with the pace of, you know, drug development and emerging healthcare issues. So,
and I think, Tammy, the other thing is, like, what we've been doing is bringing the healthcare professionals together. And we did that during COVID because no one could get out. But I think that was really helpful because, you know, we identified issues and problems that the healthcare community was experiencing. And healthcare professionals were able to get together and come up with a solution or create plans within their own communities. And I think that's really, really important. Because the landscape of medicine is always changing, and you need a lot of minds into it to create the solutions.
Yeah, and there's a lot of questions also, like, why would a university need venue? But what we learn is when they review our curriculum, they want it. And they are willing to integrate it into their own faculty and student time. And I think what's kind of been assumed here, but we should probably articulate explicitly, is that many of the pharmacy schools are still very focused on the drug transaction, on procurement and supply chain and inventory, which is very important. But the idea of introducing the model of patient-centered care is really where venue is different. And they've probably heard of the model of patient-centered care, but they don't have a toolkit to implement it. How do you actually integrate patient-centered care and, you know, key consultation points and a communication with the patients into their daily practice? So that's what every training module and every session we have, the underlying theme is the patient, and changing really the paradigm from this is a drug-centered transaction to this is a patient-focused interaction. And it's 2 ways. And what I like to say is that for those of you, probably all of us, familiar with neonatal health, you know, when the baby's first born, there's this golden opportunity. I think it's called the golden moment, or the golden minute, where if anything is you know, in stress at that moment, you have a very, very pressured time to fix it, right? To assess and to fix the issue. And it's a golden opportunity to save a life. And while it's not quite the same, I do think we have kind of a golden opportunity when a patient or a caregiver is at the dispensing counter, wherever it is, rural or urban, you know, Asia, Africa, or Latin America, or the Middle East, you have like a captive audience. So don't just hand them their medicine and say that here's your antibiotic, you owe me $1. But, Terry, you always counsel, accuracy over speed, like slow down and take the time with each patient to, make sure they know, they verify why they're taking the medicine, how to take it correctly. You've verified the prescription. If they're childbearing age, you've thought about those type of concerns, and maybe called the physician, the prescribing physician, to change that prescription. And then also, I'll say, like, I'm here in Boston, meeting with the global mental health movement founder, Vikram Patel, and it's a golden moment to really, I think, in these days, even engage in mental health and well-being or reproductive health, and to say, how are you doing today, and make a referral if that person is under distress. Okay, Terry, go ahead.
The one thing I think, Ben, you did identify early on when we were developing the program was the gap between the doctor and the patient. And there was a big gap. And a lot of times the patient goes in there and they're nervous with the doctor giving them their quote unquote diagnosis, let alone their treatment plan. And so they do this. The doctors sometimes, we talked to a clinician, a doctor in Korea, and he sees 100 patients a day. And so you can imagine the time he has to tell the patient, understand the problem and give the patient advice. So I think the pharmacy staff helps fill in that gap between the doctor and the patient and make sure things are being done correctly, so it's treatment outcomes improve. So I think that's really, really very important, the role that we play and we stress during our classes.
A great question, John. I hope we can continue the conversation as well going forward. And I will just say that John has been very generous to introduce us to Rotary International, and I'm happy to report that our country manager for Nepal just met with Rotary Nepal president. So we're getting there. We're getting there thoughtfully and incrementally, but we appreciate it, and I'll follow up with you.
Tammy, this is Frank. Hi.
This is
I would like to hear a little bit more about some of the problems for pharmacists in Rwanda that are unique. And specifically, how does Pacifique feel that Venue can approach those problems that may be quite unique to Rwanda as compared to some of the other places in which we're working?
Great question. Pacifique, I'll open it up for you to answer from Kigali.
Yes, thank you, Frank. That's a very good question. In fact, some of the challenges that are common here in Rwanda, first of all, it's as Tammy said, the program is like the pharmacy program is more of pharmaceutical management, procurement, drug-centered. Now they are in the process of transition. They are reviewing the curriculum to make sure it's just patient-centered. And you realize that the majority of pharmacists are working in community pharmacies where they interact directly with patients. So they need those skills. They need clinical skills to interact with patients. Of course, when they are at school, at the pharmacy school, the University of Rwanda, they have some basics, but when we talk about new global health challenges, such as the management of non-communicable diseases, or the management of cancer, oncology program, so those new innovative programs, and for instance, like mental health, etc. So those are some of the areas where pharmacists need advanced training. And not only that, we also have been discussing about even soft skills, how can we also include those those programs, such as like communication skills, training people to make sure they're able to interact with patients, and then they're able to communicate the information to patients. So those are some of the issues. And like if we compare with developed countries such as the US, for instance, they have a PharmD program. Pharmacists are trained like in the clinical, just to work in clinical settings. And of course, there are other pharmacists who go for the bachelor's degree, and then they also still work in the clinical settings. But you realize that in Rwanda, the majority of the pharmacists are just trained in a system that is just drug-centered. How do you manage medications? How do you procure medication? How do you make them accessible? So they need those skills, especially when it comes to clinical management, and then also interacting with patients, communicating the information. And we are not only focusing on that, we also think about other innovative areas such as research, because we know it's very important. Like sometimes you want to know, oh, what are the main challenges in Rwanda here, and then you realize there was no study conducted, and then we want to take decisions that are just like a data-driven decision making. So we want to also mentor pharmacists in research so that they have data. Like we have data available, but how do we really document the work we are doing, and then or we assess challenges on the ground, and then we publish it to share with the rest of the world, or also some best practices. So those are some of the areas, like areas of quality improvement practices, like how do we improve the quality of services we are providing if we are building systems. So those are some of the main issues. And you realize like Rwanda is now becoming a hub where now, like in terms of pharmaceutical manufacturing, they are really working with some manufacturers to start manufacturing some medications locally, vaccines, etc. And they have been investing in. There is a center of excellence in pharmaceutical supply chain management, but the area, the clinical side, patient centered practice is still lagging a little bit behind. So that's the area we need to focus on. And then when it comes to continuous professional development, it's a requirement, but you realize pharmacists do not have time to go for trainings. They are there serving patients. So when they have access to two digital platforms where they can just follow some trainings from their places where they are serving, it's an added value for them. So those are some of the areas we are considering. And then working with the University of Rwanda, like we were talking about pharmacists, but also we want to start from early stages from the University of Rwanda when they are training pharmacists. How do we prepare them to transition from them being students but to becoming professional pharmacists? So having those pre-service trainings and basic skills they need when they are practicing. So that are some of the areas we are considering. Thank you.
Thank you.
Okay.
Great, Pacific. Thank you. If there aren't any other like pressing questions, I'd love to wrap up on time. Sajida, I want to thank you for joining.
John has one.
Oh, okay, sure.
Yeah, no, I think he wrote it in the chat box.
Oh, I'm sorry.
It's on the clinical records of pharmacist.
Oh, let's see. Could can you say your question?
Sure. Okay.
Sure.
I think
This is I think these ideas are really creative, and I'm wondering how traditionally pharmacists haven't had client records that indicate the diagnosis, the possible treatments, the treatments given, the evolution of the whatever the condition is, and eventual outcomes. In fact, most people go to pharmacists just to get the drug. I mean, that's what Pacific has been saying. I mean, it isn't a drug transition. As you're moving to clients, then you have to figure out, well, how do you? It's additional work, but it's also a benefit because it begins to demonstrate the value that this new client-centered approach might offer clients, their families, the health system in general. So that's the question: is, are you backing into a whole clinical records system for based upon people who come to your pharmacy, and if you are, what are the implications of that for cost duplication? Health systems don't do very well with records, and I wouldn't imagine that small private sector pharmacists would have the resources to maintain those records.
That's a very good question as well. Pacific, do you want to maybe just speak for a minute about, from your perspective, what you know of the system where you work?
Yes, thank you. Thank you. Like from my experience, we have been relying on a paper-based system. Yeah, as you said, like in low-income countries, even the clinical side, I mean, like physicians, they have been just like relying on a paper-based system. And now we are working with just like our partners, like the Ministry of Health, to introduce an electronic medical record system. So it's just like one of the examples I'm sharing from Liberia, where pharmacy will also be part of it. In past, has been just like the patient bringing a medical prescription to the pharmacist or to the dispenser at the dispensary point. But it's just like a program we are piloting in Liberia, so that like the pharmacist will be able to review the records in the system, and then but it's a wrong way to go. It's still relying on a paper-based system. And when it comes to private pharmacies, they just have electronic inventory management system, which are just focusing on managing managing pharma medications and transactions. So it's a very important issue to consider, especially also for the private sector. Now that the public sector is planning to move to transition from a paper-based system to electronic system, medical record system, it's also an important area to consider for the private sector.
South Africa is working with clients having smartphones and keeping the records themselves. So they're just asked to say, bring along your records, and when you come next time. And that may be a lower cost way of doing it. Not everybody in low-income countries has cell phones, but 75% of the people in Kenya, for example, a neighbor of Rwanda, use smartphones now. So I think that may be the way to go, as opposed to a system-wide response. So sorry.
So what I found out working in rural communities, in the low resource healthcare settings, is it was also was important for the pharmacy staff to engage with the patients themselves. And that means helping the patients know that they have to be responsible too, and getting them involved in their healthcare. And by doing that, I would have them say, let's start your vaccine records, because I would want to know what their vaccine records are, and have them have their card. And it wasn't, they didn't have access to the cell phones when I was doing it, because I'm ancient. But I would have a paper that I would give them and have them write down and make sure that they got involved with their healthcare, and then they could bring that back to me and I could see what they were doing. But I think your idea of using the cell phone, and then you can put that in the notes, your healthcare notes, and keep that record, was really important. And I think by having the patient engaged in their own health, it helps them stay on course.
Yep.
Absolutely.
Great. Thank you.
All right, I'll wrap it up just so we finish pretty much on time, but thank you again, everyone, for joining. You know, our goal today was just to come together as a collective group around, you know, not only venues, you know, mission and vision, but our really broader shared passion for global health equity. And as I said, giving voice to those who otherwise may not be heard in terms of their right to health and well-being and productive happiness. And I want to thank you all very much for your time and your comments and such a great conversation. I will be sure to follow up with each of you about the ways you can continue helping us. Everyone who is on this Zoom is a champion of Venue's work, and I'm grateful to you for the doors you have already opened, and I hope will continue to open for us in terms of introducing us to others and investing in our work. So thank you, and have a great afternoon. We will follow up with you. Thank you, everybody.
Thank you, everyone.
Especially Pacifique, thank you. All right, take care.
Bye.